So welcome to the World Health Network. We are here for an Advocating Health course today. We are very excited to hear from Kohelet Policy Forum and Civil Society Forum speakers. We have been at it now for 2 years, trying to advocate for policies and get them word out to make safe decisions across both individual and policy level. And it is a struggle. We have the science. We know what to do to keep ourselves safe from COVID-19, but it is just hard to convince our community, individuals, and the world around us to follow the science. So we're really excited today to welcome these wonderful speakers that will give us some tips on how they've been successful in convincing through social media, working with journalists and policymakers to make changes in their own country. So I will turn it over first to our first speaker, Ariel Karlinsky, who's going to be speaking us about a very important metric, excess mortality. That is an undeniable metric, and he will be now opening up to talk to us about the statistics that convinced the world. Thank you, Ariel, so much for joining us today.
Thank you for having me. My name is Ariel. I'm a PhD student at the Hebrew University in Israel, and I'm a member of the World Health Organization Technical Advisory Group on COVID-19 Mortality Assessment, in which we are trying to assess the mortality from COVID-19. And you might be wondering, why do we need to assess it? It's being published daily by Johns Hopkins University or by the World Health Organization. There are so many dashboards from so many countries and globally. But what these dashboards do is they report COVID-19 certified deaths, which have come under a lot of criticism from, let's say, both sides. And what I'm doing and what we're doing at the WHO Expert Committee is we're looking at something which is a little different, but as mentioned, it's a much more objective indicator, and hopefully convinced and will convince, especially once the WHO report comes out, which I hope is soon, about the true toll, devastating toll that COVID-19 has caused. So let's talk about excess mortality, what it is, and what I'm finding. And if there are any questions you want to comment, please go ahead. I want to make this as interactive as possible. Okay, so I'm going to tell you a little bit about what the hell is all-cause mortality data. Going to talk about my work, which is the World Mortality Data Set. And then we're going to talk about excess mortality in COVID-19. I'm probably not going to finish all the slides. If anyone really wants the slides, I'm more than willing to share all of them. All of my data, all of my information I put publicly, hopefully for use by good, but sometimes it has already been used not for good. Okay, so why do we even need all-cause mortality data? Like I said, we have all these even daily reports of COVID-19 deaths throughout the entire world. So here in Israel and pretty much everywhere else, with everybody I'm talking to, whether it's from people in India or in Tanzania or in Guatemala or in Nicaragua or in the US or in the Netherlands. So there's this entire public discourse on accuracy, on false positives, dying with and not from. When we think about COVID-19 compared to, for example, the Spanish flu or any other pre-modern pandemics, this was completely irrelevant, right? There was no PCR test for the Spanish flu. There was no serological test for pretty much any pandemic that we had in the past. So how do we even know how many people died in the Spanish flu or the London plague of 1665 or just any other condition that you can think of? And the answer is what we call in demography excess mortality. So I'm an economist by training, but now I mostly deal with epidemiology and demography. So here you have data from 1918, which is pretty amazing, from the city of Hamburg in Germany. It's weekly deaths. So each point here is the number of people who died in each week in Hamburg. So as you know, death is a certainty. Everyone dies, unfortunately. And for a given population, for a given size, we can predict pretty well how many people will die in winter, in spring, etc. Of course, there are some changes in this. So, life expectancy increased dramatically in the 20th and 21st century. But basically, once you know how many people died, for example, the previous year, you will know how many people will die the next year in a given city or country. And even on a more granular resolution, such as week or month. So here we have data from the city of Hamburg in Germany, 1917 to 1919. And you can see the gray lines, they're very similar to each other. So between 1917 and 1919 in Hamburg, once you knew how many people died in 1917, you have a pretty good guess of how many people died in 1919. But then you have in 1918, you have the flu peak. It's in red. And even if I didn't paint it red, it's clearly visible. So even if doctors hadn't tested or said something that they think there's some sort of flu going on, it's very clearly visible that the Spanish flu has killed many people in Hamburg. You can see that the peak has something like 1,500 weekly deaths, while usually there are about 600 weekly deaths. So that addition alone is 1,000 people who died from the flu, that's deaths above and beyond what you would expect under normal circumstances. So in order to do these excess mortality estimates, we need data. And there are many organizations that collect this data, but they usually collect it with a significant lag, and they usually do it by year. But as you've seen from Hamburg, you need weekly or monthly data to have a good estimate of excess mortality, and you need it in real time. You want to know what's happening now, not what happened 20 years ago. So there was very little such data. There are some data sets about this. You probably, and me included, have first came upon this topic from the media, like the Financial Times and The Economist, who have done really great work on this. And they usually take their data from what's called the short-term mortality fluctuations data set from mortality.org, which is a very well-respected institution in demography. But they have a lot of high-income developed countries, mostly Western Europe, also some, Canada, the US, Australia, New Zealand. That's also new additions. And what I do is I build upon these data sets, and I also collect data from all over the world. Wherever I could get my hands on data, doesn't really matter where it's from. I collected it from the websites of National Statistics Office. It's a lot of time it's hidden in plain sight. And unlike COVID-19 data, which was in the spotlight and personally I think has been subject to manipulations by not well-intentioned governments, this data about total number of deaths is undeniable and has been published regularly without much attention given to it, which I use in a sense to my advantage to produce these data sets. So here you can see like a nice example of the kind of data that I'm dealing with. This is all-cause mortality data by month in Azerbaijan, in Egypt, in Japan, and in Serbia. And if you contrast, for example, Japan and Serbia, this is 2020 versus the end of 2019, and in Japan it's 2019 versus 2020, you can see immediately that in Japan, mortality in 2020 was pretty much in line with 2019, and there's virtually no excess mortality, which is also what I find. And you can see that in Serbia, there's significant excess mortality. So, 2020 had over 17,000 deaths, while 2019 December had about 8.8 thousand. So this difference, this crude difference is what we call excess mortality. So our data set has 118 countries and territories. I'm constantly maintaining and updating it. I just pushed an update yesterday. you can see here that the countries that we have data for. Again, I tried getting data for all the countries, but some don't have it because they're literally not registering deaths at all, or not in speedy enough manner. And some countries should have it, have chosen not to publish it yet due to, again, various reasons, for example, Turkey. And some countries are supposed to release it in the coming months and years because that's what they're used to doing. They're used to having a significant lag where they're reporting such data. But we do have some data. For example, India is a federation of states, and we do have data from some states in India. And you might have seen some reports and some scientific research estimating, for example, excess mortality in India, which goes with a similar method to what I'm going to show you here. Okay, I'm gonna skip a little bit. The research has been peer-reviewed and it's been published, and it's currently the source for all-cause mortality data and excess mortality estimates for our world in data, where you probably have already seen my work, even if you're not aware of it. There's a small caption there that says that it's my data. The World Health Organization Task Action Group, which I'm a member of, and The Economist and the Financial Times, which are also producing these sorts of reports and estimates, and they're relying on my data and methods. Let's look at some plots after I told you how I got this data. So here you can see all the countries and territories in our data set, and you can see deaths from 2015 to 2019, where it's weekly or monthly. So, for example, in Israel and the United States, data is weekly, but in Ireland and Georgia, right here, the data is monthly. And you can see here what we demographers call seasonality. Deaths are higher in the winter than in the spring. You can see here that in the southern hemisphere, it's exactly the other way around, because winter is in the middle of the year. So in Argentina, deaths in the winter are higher than the spring, but winter is in the middle of the year. I'm going to just put, just like I showed you about Hamburg, I'm just going to put 2020 data right here without any, very sophisticated models or whatever. Just going to show you 2020. You can see that 2020 mortality is significantly higher than what you would expect based on 2015 to 2019 in many countries. Bolivia is a very good and tragic example right here. All the differences between 2015 to 2019, seasonality, population aging, etc., just vanishes completely when you put 2020, and peak mortality in 2020 in Bolivia was much higher. The same goes for Brazil. The same goes for Kuwait, Kosovo, Jordan right here. There are some countries where if I hadn't shown 2020 in bright red, there's really not much going on. And these are mainly countries who had strict border control, and COVID-19 simply did not spread there. And if COVID-19 does not spread, it doesn't kill. It's very simple. So you have here countries like Norway, South Korea, Japan. Where is Japan? Japan should be somewhere here. Japan. Even countries like Jamaica. So if COVID-19 doesn't spread, it doesn't kill. 2021, we already have data for most countries, also for 2021. Unfortunately, it's the same story, and in some countries, it's even a harder story. So, for example, Malaysia here had virtually no excess mortality in 2020 because of border control and lack of human tourists, for example. But in 2021, it reopened, and excess mortality has reached Malaysia in 2021. We still don't even have full 2021 data. Same goes for the Philippines and other countries. You can see here, for example, New Zealand, both 2020 and 2021 and the beginning of 2022 data that we have for some countries, there's virtually no excess mortality in New Zealand. I'm going to skip a bit over the science part. Let's take a closer look at the US, for example. You can see here, again, in gray, 2015 to 2019 weekly deaths. You can see in black the number of weekly deaths that I expect using my model. Many other models exist, but they don't really change the outcome. And you can see in red 2020 deaths and in blue 2021 deaths. And you can see that 2020 starts pretty close, even a bit lower than what you would expect weekly deaths to be. But the difference here is essentially zero. And once COVID starts to spread, which is about mid-March in the US, this is the horrific first wave in the eastern coast of the United States. The US has been in a state of significant excess mortality ever since COVID started. There's just no way around that. And you can see here that it matches, if you know how COVID-19 waves look like, and I don't know if you'll have the chance to look at it more closely, it closely matches COVID-19 reported deaths. Yeah, okay, so here it is. So here you can see for several countries, COVID-19 reported deaths in black, and our excess mortality estimates in red. And you can see that it closely aligns. For example, in Colombia, it's almost a one-to-one match. In the US, the same. In some countries, excess mortality is higher than COVID-19 mortalities, and in some countries it is much, much higher. So you can see here, for example, South Africa, where every time excess mortality is about 3 times higher than reported COVID-19 deaths. And there are countries where this ratio is even higher. So if you look here, for example, here what we do is we estimate excess mortality for each country, and we divide it by the officially reported COVID-19 deaths. So for Israel, the US, and most developed countries, this ratio is about 1. So if Israel reports 1,000 COVID deaths, it has an excess mortality of about 1,000. It could be 900, it could be 1,100, but it's going to be very close to 1,000, which essentially means, first and foremost, that these people died from COVID-19. They did not die with COVID-19. They died from COVID-19. Because if they would have died with COVID-19, there would be no excess mortality. It would just be a change of cause of death from regular causes of death to COVID-19. But excess mortality is exactly the metric that you want if you're trying to think how many people have this killed more than you would expect. Because again, yes, people die every day, unfortunately. And a pandemic, a disaster, a conflict, a war, what it does is it kills people above and beyond what you would expect. So in South Africa, I showed you this ratio is about 2.5 to 3 times. So for every 1,000 COVID deaths reported by South Africa, excess deaths are actually 3 times higher, which is huge. But it's actually much less huge than when compared to other countries. So in Tajikistan, for example, which is our world leader, it's a small Central Asian former Soviet country. Up to the end of 2020, they reported 93 COVID deaths. It's a population of, I think, 3-4 million people. I think you already know that this does not sound likely. 95 COVID deaths, that's not likely. Indeed, excess mortality in Tajikistan is over 9,000. So it's 100 times higher. In Nicaragua, it's 50 times higher. In Algeria, it's 15 times higher. In Egypt, it's 12 times higher. In countries like El Salvador, and Albania, and Kazakhstan, it's 5 times higher. So for every 1,000 reported COVID deaths, they have 5,000 actual excess mortality deaths. How much longer do I have?
We have, you can go 5-10 more minutes, including questions.
Okay. So here I'm going to zoom in a little bit on Eastern Europe, Eastern and Central Europe, which have bared a significant brunt of this, and where reported COVID-19 deaths in several countries have shown a much rosier picture than this. So Russia is in the news right now, of course, Russia and the Ukraine, but Russia is a very, very good example. So the ratio between excess deaths to reported COVID-19 deaths in Russia is about 5 times. I think now it's 4.5, something like that. So if I go back a little bit, you can see that in Russia has over 1 million excess deaths up to the start of February 2022. It has reported about 300,000 COVID-19 deaths. And this has been used to declare the superiority of the Russian approach to COVID-19, which was essentially to do nothing except for small restrictions on movement back in, I think, March to May 2020. This has been compared favorably to, for example, the US, the UK, and many other countries, saying, look, we have much less COVID-19 deaths because we dealt with it properly, and it was also used to spread mis and disinformation on the Sputnik vaccine versus the Pfizer, Johnson & Johnson, and other vaccines. So in Russia, as mortality is clearly visible, 2020 mortality is much higher in every single month, basically ever since the pandemic started. You can see it here. It started like in April, May. 2021 was no different. In some cases, even higher mortality over. If before between 2015 to 2019, monthly deaths in Russia never exceeded 180,000. And in 2020, you can see that it broke away from over 200,000. And in 2021, it exceeded 250,000 two times. A similar story is in Serbia. In other countries like the Czech Republic, the ratio is pretty high. It's pretty similar to 1. So they reported it pretty accurately, like many other developed countries. But there's clear excess mortality. So this is not, inflated COVID-19 reporting. These are unfortunately the deaths caused directly by COVID-19. And like I said, there are some countries where there's no significant excess deaths. Japan, Taiwan, New Zealand. You can see that deaths in 2020 and 2021 are pretty much in line with what you would expect. There are small deviations, but they are within normal variation. These are not these huge peaks that you saw in Bolivia, in Russia, in many other countries. I'm giving this talk every few months. Back when I gave the talk last time, there was no significant excess mortality in Singapore, in Denmark, and in South Korea. And now we have the end of 2021 data. You can see that, unfortunately, once COVID-19 spreads and you're not able to stop it at the border, as New Zealand and Taiwan and Australia have done, it kills. It's a very simple and sad fact, but it kills. So there's statistically significant excess deaths in all of these countries now. They still have, it should be said, a very low toll of COVID-19 and excess deaths compared to all these other countries, which have been in a state of significant and sustained excess mortality ever since COVID-19 started. So in these countries, in some sort of sense, COVID-19 only started in mid to late 2021. And that's to their credit, because now they have vaccines and the situation is much better.
Ariel, we had a question from Richard.
Yes.
Richard, if you're able to come off mute, please go ahead with your question. Thank you. He's asking, what is the most significant surprise to you in analyzing this data?
I think, in a sense, the most surprising thing about this data is how much, I'm gonna be crude, how much bullshit people who should know better and have Nobel Prizes and hold esteemed positions as professors for topics related to or not related to epidemiology and demography have been talking using the officially reported data, which I, as a social scientist, I know that the first thing I need to find out about data is whether it's reliable. So there's also been an American-Israeli professor that has touted Belarus, for example, as an example of good communication with citizens, which is laughable, because he talked about their low reported COVID-19 death toll. Excess mortality showed that COVID-19 was much worse in Belarus, about 15 times higher. So for every, again, 100 deaths that they report, the total is actually 1,500. So it was quite shocking and saddening for me to see all these very, very smart people, I'm not doubting that they're very smart, relying on what to me looks like obviously pretty forged data. It could be, again, forged because it could be non-reliable because of capacity constraints. So believe yet doesn't have the capacity to test as much as developed countries have. And it's also sometimes due to direct manipulation. You can see here, for example, the difference in excess mortality to COVID-19 reported deaths in the Czech Republic, where they're pretty much completely aligned, and they're trying to report and they're trying to track the pandemic and its toll. And in Russia, you can see that there's just no, they track together completely, but the true toll is much higher, now approaching 1.2 million, while they reported less than 400,000. So to me, the most depressing thing about this research has been how much people want data and information that justifies what they already thought beforehand.
All right, Ariel, I was going to move us into discussion mode here, if that's okay.
Mm-hmm. Sure.
Now everyone will be able to interact and speak with Ariel for the next couple of minutes before we move on to Sara, who's going to be talking about activism and social media. Richard, would you like to respond to that? All right, does anyone else have a question for Ariel? All right, well, thank you so much, Ariel. That was wonderful and such an important metric. So thank you so much for coming to speak with us today.
Thank you for having me.
Absolutely. All right. Sara, welcome. Sara,
hey.
This is Sara Hatzman-Cohen, and she is the chairwoman of My Israel Movement, coming to speak with us on activism via social media.
Yep. So hello, everyone. Thank you for having me. First, a few words about myself and the NGO that I'm running. My name is Sara Hatzman-Cohen. I live in Jerusalem. I have 4 kids, and I'm running an NGO called My Israel. My Israel is one of Israel's largest grassroots organization. It's dedicated to promoting activism online and on the ground. What we do is that we drive change by empowering our more than 200,000 followers through all the different social media. And what we empower them to take action to defend Israel, to counter BDS, and strengthen the Jewish communities all around Israel and around the world. So it has nothing to do with the COVID, but what we can take from my activity, from my daily activity, it's practices that you can use in, I think, every field. So what we're gonna do now is, I'm not gonna tell you how to use social media, but how to use them in the right way in order to get the most impact. So I'm gonna run without a presentation, but I am going to share my screen in a few minutes to show you examples. Now, the examples are going to be in Hebrew, and I will translate them. But what I want you to understand is not exactly what's written there. It's not that important, but it is important to understand the principle. So Facebook is I think it's the most popular social media in Israel. The Instagram is giving a great fight, but the most popular is Facebook. Except really young people, most of the people in Israel, most of the public has a profile in Facebook. What's good on Facebook is, since everyone is there, so you can get your messages easier. So it's the biggest platform in Israel. It's very popular. what you can do there is you can share something that was very, very good and effective during the COVID, since it erupted into our life, is personal stories. So a personal story is one of the best ways to fight fake news. You can hear on Facebook. I'm gonna talk. Most of my talk will be about Twitter because it's one of the most influenced platform, social media platform in Israel, and I'm gonna run into this in a few minutes. So one of the best things on Facebook, there are two advantages. The first thing is stories, personal stories, sharing personal stories of people who had COVID, who can testify upon themselves how bad it was and how they suffered. Personal stories about whoever didn't take the vaccine. The other thing is on Facebook, the other advantage is that the platform of Facebook, it enables you to mobilize people, to recruit them to different actions. For example, one of the in the first wave of the COVID here in Israel, people felt really thankful to the medical staff. So they one group on Facebook, they set a time, 6 p.m., and they said everyone is going to their balconies and just clapping to, let's do it together. Let's do something together. And they took pictures of themselves and videos, and it ran into the news. And it was so exciting, but you couldn't do such a thing in other platforms. It was harder. So mobilizing people, asking people to email someone, what we call bottom-up pressure. Facebook is one of the most important platforms to do it. Now, what we saw on COVID is that the science got into our life in a very soft way. Science, the science came to our daily life, not just with going to the doctor or taking the vaccine or anything like this. But what we saw that through social media, people that are very specializing in different fields, researchers, doctors, medical staff, just came into the social media. I don't know if they've been there before, but they didn't talk about science before. They didn't talk about medical stuff before. So it came into our life in a daily, in a suitable language to the general public. Now, Twitter is one of the most influencing platform in Israel. And why is that? Because most of the politicians are there. Most of their speakers and their staff is there. It's like the backyard of the reporters in Israel. So they can talk to each other. They can see new things. It's like their field. They can find news through Twitter. And you can also use, you can print screen and then put it in different platforms. This was very popular here in the COVID time. So what we saw in Twitter is the medical staff started to use Twitter. I want to show you a very special one. His name is Dror Mevorach. I'm going to share my screen in a minute. His name is Dror Mevorach. He's the head of internal medicine department in one of the biggest hospitals in Israel. And still he finds the time and he knows how important it is to write and to tweet on Twitter. Another thing is that he's a doctor in in Jerusalem. Now, Jerusalem is a very, we have different populations in Jerusalem, very different from each other. We have ultra-Orthodox, we have Arabs. It's a mixed cities. It's one of the most mixed cities in Israel. So this guy invented the Jerusalem Index, or the Hadassah. Hadassah is the name of the hospital he works in, Hadassah Index. And then he said, I don't know what's happening around the world. I know what's happening in my department and in my hospital. And this index just made a great impact in everything connected to the COVID. Now, I want to show you. Okay, let me do this. I'm going to share my screen. Hopefully, I'll know how to operate this. Here is the guy. Okay, so here is Dor Mevorach. Okay, you see, this is his Twitter account. He's a physician, a scientist, professor of medicine. You see, he's a very, very important guy. And he came to Twitter he came in the middle of the COVID, and he's telling different stories about his department, about his hospital, and it's very interesting. It's very interesting to different professional people, but also to the public. Now, he's also talking with different like regular people. You can see here he shared Moiz the Katan, that's little Moiz. That's a guy I'm going to talk about in a few minutes. But he's sharing his information. So you can see a doctor. He's running a department in one of the biggest hospitals in Israel, and he's sharing information of regular people. This guy, the little Moiz, he's not even a scientist. We'll talk about about him in a minute. I'm gonna stop the share of this guy. Here, okay, take this for example. The Hadassah index is still low, but I'm gonna. I think that in the future it's gonna be more dominant. Okay, I'm gonna stop the share for this guy, but this is one example that this very important guy, he's very busy and he still understands how important it is to reflect the public all what he see in his daily life. Another thing that we saw, another thing that is very dominant in Israel, that the committee of ministers and the discussions in the Israeli government are not open to the public. Now, this makes a lot of trouble with reliability. The public does not understand why do I need to give my 5 years old a vaccine, for example, because nothing is open. All these discussions are not open to the public. But what is open to the public? So one of the advisory committee, one of the members, of the advisory committee to the government, he's a professor. I'm going to share the screen and show you his Twitter profile. Hold on. Okay, so his name is Eran Segal. He's a scientist in the Weizmann Institute. You can read his bio, and he is a member of this committee that advisors to the government, to the ministers. Now, what he does, he tweets. Okay, he tweets about different decisions that the government is taking. He tweets about. Sorry, someone opened his. Okay, he tweets about different research. He tweets news from the world. You see, he tweets in English and in Hebrew. Now, what is this doing? This it enhances the transparency that it doesn't happen in a regular on a regular basis, as I told you before. So it enhances the transparency, and since this, it also brings up the reliability of the government decisions. So scientists, what we saw since the COVID erupted into our life, that scientists and researchers just got into the new media. They opened a Twitter account and they started to tweet. And when they tweet, what they are forced to do is to keep it simple, because if they won't keep it simple, they won't have any popularity. Nobody will follow them. They don't have likes, and no one will share their content. So they are forced to speak in a language of of the general public. Another thing that we saw is, it's very, very special that on Twitter, that regular people just took their hobbies and made them into a profession. For example, this guy that we saw before, Little Moise, I'm going to share the screen and open his Twitter account. He has a restaurant. Okay, he's not a scientist. He's not a doctor. He's just a regular guy from Tel Aviv. He has a sushi restaurant, and he started to, on COVID, he's a data, I don't know, he really likes data. He likes Excel, and what he did from the beginning of the COVID is to share data and to take, big numbers in big graphs, and to just to give it to the public in the language, and to make it simple in the language they understand. So, for example, Little Moise, this is a tweet from today, and he gives numbers. He said, okay, heads up, good morning. We already have 400,428 people who are sick who got the COVID now. Heads up, it's gonna be it's coming back, okay? And here's another guy, and this guy, Alon Cohen, is telling him, listen, you're not a prophet, but I do trust your data. If I'm getting married in a month, do I need to be worried from the COVID? So, and look who we see now. We see Dror Mevorach. Dror Mevorach, I remind you, he's a professor, okay? And then he answers this guy who's anonymous, okay? Nobody knows Alon Cohen. He has 52 followers, and Dror Mevorach answers him and tells him, yes, you do need to be worried. And then he gives him this explanation. It's not that important, but look what's happening here. That it's amazing. So and this guy Moise, what's his advantage? One of his advantage that he knows how people speak. He's not in the lab. He's not in the medical. He's not in the hospital. Dealing with researches and stuff. He's dealing with sushi. That's what he does. So he knows how to speak with people, so they understand and they will care. He's using graph. Sorry, I'm gonna show you another thing that he does, and we're gonna finish in a few minutes. Okay, here. Okay, so here we just celebrated. We had a holiday, Purim. Everyone is celebrating, big parties, big meals, and he's updating after the holiday. Okay, and he gives a graph. Now, this graph is very simple. It's not complicated. It speaks on a daily, everyday language. And he did these graphs all the time. So when a regular guy who is not from the government and he's not a doctor and he's just running a sushi place, when he gives information, it enhances the reliability of his information. Now, another thing, nobody pays him. Okay. Now, through Twitter, he got into the news, he got into different TV shows, and it gives his voice more his voice gets louder through the regular media, but he started on Twitter. Also, what another very interesting thing is that he took the information and the data that from the Ministry of Health, and he simplified it. And then people, when I want to know what's happening, I'm going to his profile. I'm not going to the Ministry of Health dashboard. I'm just going to his profile to understand what is happening. And he shows that everyone can do it. Everyone can do it if you give good information, with high value information that people care about, and if you use this information in a right way. I'm not going to touch Instagram, even though it's very popular in Israel, but I do want to touch a new platform, social media platform, which is TikTok. Now, TikTok is a rising platform in Israel and in the world. It's only videos, and very simple videos, and it's built on trends. Now, the advantage of TikTok is that you can get to young adults through TikTok. For example, if the young adults are not in Facebook, but they are on Twitter. So what you can do is you can use TikTok to reach these guys, and then you can also spread your videos on Facebook, on Twitter, everywhere. The videos you created on TikTok. When we talk about vaccinating kids and young adults, TikTok is a very important platform that can be very effective, and it simplifies things. That's it, I think. We're out of time, and I think I covered most of the examples I had.
Well, thank you, Sara, so much. Those were really helpful examples and a nice overview of what platforms help us with what things. So if anyone has a question for Sara, I would like to allow a moment for a question. Otherwise, we'll move on to Meir Buchnick. All right, let's move on. Thank you so much, Sara. Next up, we have Meir Buchnick, Deputy Director of the Kohelet Policy Forum, speaking to us about convincing policy matters. Thank you, Meir.
Hey, thank you. Okay, so again, a few words about myself. So like Katie mentioned, today I'm the Deputy Director of Kohelet Policy Forum. Previously, I was a staffer on the Hill. I was in charge of foreign policy for Congressman Doug Lamborn. And the reason I'm mentioning this is because what I'm going to try and speak to you today, about today is how to influence policymakers. But obviously, policymakers are different in different countries. So what I'm going to try to do today is, based on my experience being in the US and in Israel, give you 5 guidelines, I would call them, that I think are true in any system where you have policymakers, And when I speak about policymakers, I mean mostly I would call them elected people, politicians. But I think many of the things I'm going to mention today are relevant also to policymakers as in officials. So the 5 guidelines are going to be credibility and professionalism, rules and tools, interests, form a relationship, and the last guideline is don't take any credit. So let's start from the top. So especially in your field, where what you're trying to do is to promote awareness and policy about the COVID, what you have to bring to the table, your greatest tool really is your credibility and your professionalism. Meaning what you have is really information that most people don't understand and don't know. And that's what you can use in order to change policy. So the first thing you should know about policymakers, and I'm sure this is not news to anyone, is that they're very, very busy. Normally, policymakers have to deal with many various issues at the same time, and they don't really have time to go into in depth into the issues. On the other hand, policymakers often really try to remain relevant, and what that means is that they are always looking for something to do, something to keep them out there, interested in, make people interested in what they have to do and what they have to say. So that's where you come in. You have that information, and if you do it correctly, you can have them do it for you. But the messages, like I said, they don't have the time really to dwell into it. So what you want to do with them, it has to be clear and concise. Now, just an example, a few weeks ago, there was a meeting at the Knesset committee that deals with COVID. With the government committee that deals with COVID. And one of the ministers yelled at the professors who came to speak to them and said, I don't understand. You send me all these graphs and you send me all this data, but what do you want me to do with this? Now everyone laughed because, you expect a minister to understand information to be able to deal with it. But the truth is, she was right, meaning she doesn't really know what all of this means. She doesn't have the time to read all the graphs and read all the papers. She needs something concise that she can push forward. And that is very important, especially in your field. COVID is very complex. I cannot say that I understand it. Every day you hear something new. Every day you hear different kind of information. And if you want the policymaker to move something that you want it to move, it has to be very clear and it has to be very concise. Also, very often policymakers like what you're giving them in what I'd like to call maybe this tells my age, but plug and play form. I've seen it many times. People turn to the policymaker and they tell them, look, I have this great idea, but the policymaker, once you give him an idea, that doesn't help. What he wants is really what you want to be done, digested, ready to use. It could be a bill, it could be a letter, it could be an op-ed, okay? But he doesn't have the time to really look into this long paper that you're going to give him. He wants everything ready. And more important than that, very often, whatever you're going to give him is going to have to go through the different channels and through the different pipes. And there are going to be questions asked, and he's going to have to answer them. And if you give him something that's not really fully cooked, he's going to come back to you with all these questions. And in a way, instead of getting his work done for him, you're creating another load of work for him. So just as an example, so here at Kohelet, when we try to, if there's a bill that we want to push along, or even if we have a member of Knesset who comes to us and says, look, guys, I want to move this, I want to create this bill, what do I do about it? We make sure that once we give him the language of that bill, it would be in a form that fits what the Knesset legal advisors like to see. So when they come back to him with questions, there would be very minimal and very small questions, and that he could just push it along. This could also be used to your advantage. For example, if there's a message that you want to get across, and you want an op-ed written, now I'll bet that the policymaker does not understand the minute differences in what the message could be. Are we trying to say this or are we trying to say that? And he doesn't really care, to be honest, about the minute differences between things. But if there's something that you want to get across and you write it into that op-ed, he would probably sign off, and there you go. You have something published under the policymaker's name for you. Same thing goes with a bill. Sometimes a bill, if there's a certain, I'll give an example over here. You want a certain authority to have the right to take action. The policymaker does not have any preference in how this is going to work, but you actually do. Okay, so if you can actually put it into that language, and he would probably not ask questions. This is not, you're not trying to cheat him. I'm trying just to explain. You're not trying to do something behind his back, and you probably can also explain what you're trying to do. But really, the fact that they would like it baked and ready to go can help you get what you want to get across. But we said credibility and professionalism. You wrote on your website, and I like this line. You said, "We build trust by saying the truth." And that is that is very important for the policymaker. Like I said, they don't have time to check if what you're saying is right or wrong. And if they would be caught publishing something that you gave them, and they're going to someone's going to find out, or someone's going to show that what you gave them is wrong, or it's only half true, that would very much go back and hurt them. And then you would lose that relationship with that congressman, or with that policymaker. So you want to make sure, always double check that whatever you give is not only concise, not only clear, but also validated. All the information there is true. Moving to again. If you do this, very often what you find, and this is what we found at Kohelet, is that sometimes the policymakers become addicted to you. In the sense that they know that they have someone who can give them information, do things for them. Their information is correct, and they'll start counting on you. They would basically need you for their everyday work, and that's good for you. So if you keep your credibility and professionalism, and you might even get them addicted to you. Rules and tools. So it's very important to think out of the box. I know, especially today, it's very popular to think of out of the box, but the truth is that even a masterpiece has to be made with a simple chisel. Okay, when you come into a system when you want to deal with policymaking, you have to understand there's a system in place, and you have to learn that system. You have to understand that system, and you're going to have to work within the rules and using the right tools. And yet, like I said, there are different countries and they have different ways of working. I'll just give you an example. So in the US, for example, if you want to pass a bill, the way to do it is you have to make sure that you have enough members of Congress signed on, so that to move it along, to push it along, you have to make sure that the committee, the only way the committee will get the attention of the bill will get the attention of the bill is if you have enough members who are interested to push it along. If you do that in Israel, that's really not relevant. It could be that it could be that having many members of Knesset helps a bill, but there are much easier and faster ways to move a bill. For example, there's a committee that meets every Sunday and decides whether to push a bill along. So in that case, what you're trying to do is not just waste your time getting names on your bill, but rather make sure that bill gets on the table of the committee that's going to push the bill to a sooner vote. So it's important to understand what the rules are and work with the rules. It's not only important to understand what the tools are. It's also important to understand what is your actual goal. Sometimes the goal is to get publicity. Sometimes the goal is to get specific policy moved. And different tools would be used to do that. I'll just give you one example. So when I was in Congress in 2014, we had Israel had the conflict in Gaza, and Israel discovered that they have tunnels that the Hamas dug tunnels under Israel, and we wanted to pass a law that would would invest in technology to detect tunnels. The way to do that really is to put it onto a small undetected bill that gives all the it's the law that gives funding to different projects, and really it's a change of 3 words that you just put in, and it's a must-pass law. So if you manage to put it in, it's going to pass, and no one's even going to notice it. But that's not what the policymaker wants. The policymaker wants to get credit. So what we had to do is first we had to put it out there and get op-eds written about this special new law that's going to pass. That law never passed. Really what happened in the end is we put those 3 words into the must-pass bill that passes every year. But we used the right tools. On the one hand, we gave the policymaker the credit that he needs, but on the other hand, we got the right language into the bill that must pass in order to get the action that we really were looking for. So it's important to know which vehicle is important for what you want to do. You have to decide what is your goal and which rule and which tool to use. So I'm gonna move on. Sometimes when you want a policymaker to do something, you won't be able to do it directly through him. Sometimes maybe the policymaker, the person who counts, the person who can actually do what you need him to do, doesn't like your idea. In fact, it goes against everything he believes in. Okay, you still have to figure out what are the rules and what are the tools to get this along. And I'll give you one example. There was in Israel, we had a while ago a law that the Ministry of Culture decided that the prices of books in Israel are too cheap. And she decided that authors that people don't know yet, their books should be sold for a higher price because otherwise they don't get enough money for their writing. Now, many of those new authors felt like they want to get the price of their books lower because otherwise no one's going to buy someone they never heard about before. But the minister didn't believe that's the case. She believed that they must get their pay. And the way we managed to deal with that was not to go and speak directly with her. I mean, we tried that. It didn't work. She explained that she's just not interested. But in this case, we used something called the Freedom of Information. And we managed to get from her, she had no choice because those are the rules, that's the law. She had to give us the information about how many books of new authors were sold during the time of this law that she put in place. And we weren't surprised to find out that new authors could just not sell any books because no one wanted to pay the big price. And then we went out to the media with it. That's going to be Shuky and Ricky's lecture or speaking. But again, the tool that we used, sometimes there are other tools that you don't need to go directly. You can go and circumvent the person or try to find pressure points instead of going directly to him. So just to sum up this point, you want to find out you want to understand the system, and you want to find the best tool to get your policy moved as quickly as possible. And in fact, if we spoke before about credibility and professionalism, if you come to the policymaker with an idea and you give him this crazy idea that just won't work, he will know that you don't know your stuff. He will know that you are not a professional. Part of professionalism is actually doing the research to find out what are the right tools, what are the best tools, what are the right rules to pass your policy, and it's worth it to invest that time in learning the system well. If you have people from different countries, it's good to have the different people learn their own system and become experts in that. It's also good to build relationship with other people who know the rules and the tools, and I'll get to that later. The next guideline is interests. So policymakers, just like anyone else, have their interests, and that's what's going to make them move. Saying that someone has an interest is not a bad word. That's just the way people work. In fact, the reason you guys are here today is because COVID is something that is very close. I mean, dealing with COVID is something that is very close to your heart, and you're willing to invest the time in dealing with it and trying to move policy for it. It's very important to find out the policymakers' interests. I'm told that I'm running out of time, so I'll make this short. Very often you'll find that the position of the person is aligned with their interests. For example, you'll find that members of Knesset try to stay in a committee that is relevant to what they care about. You'll find that members of Congress do the same thing. So don't just go to any one guy and say, you know, we have this great idea. Make sure that the person you are trying to talk to is actually has a keen interest in what you're trying to do. I've seen it many times that people came to members of Congress and sat with them and spoke with them, and after 15 minutes talk, the members would say, "Okay, you have my sympathy," but nothing came out of it. The next guideline is form a relationship, and this is, I would say, one of the most important guidelines. Policymakers, why should they listen to you? We mentioned before, you should be professional, you should have credibility, but the reason people listen to other people is because you earn their trust. About this, I would say, if at first you don't succeed, help and share again, meaning the fact that some policymaker did not agree to move your policy along right away doesn't mean that you shouldn't continue trying to share information with them, try to help him with other things, because eventually he will turn back to you and try to and he'll know that you're available to him, and then you will be able to be successful. But even more important, form coalitions. There are other organizations around you that have experience doing these things. They already have the trust of the policymakers, and if you can form a coalition with them, show them that you have your interests are aligned, you'd be able to move your policy forward. And then one more. This is the last guideline. If you can forgo the credit, do it. And this is for two reasons. The first is because every policymaker likes to get credit for what they do, and then no one likes to share credit. So if you are able not to get credit for what you do, then you'll find more people willing to come and listen to you and move what you and do what you ask them to do. And the second reason is because it's easier to move things if you don't take credit, because sometimes what you want people to do is to not take any action, but you don't get credit for telling people not to take action. But if you don't care for the credit, then in that case, you can still move those kind of policies as well. These are my guidelines. If you have any questions, I'll be happy to answer them.
Thank you so much, Meir. Such a great presentation, super helpful. Does anyone have any questions to ask? All right, then we will move on to the next speaker. Up next, we have Ricky Maman, the economic columnist at Makor Rishon newspaper. Hi, Ricky.
Hi.
Hi, thanks so much for joining us today.
Well, thank you for having me.
Absolutely.
Everyone can hear me okay? Okay, thank you. So I'm Ricky, as Katie mentioned, and I'm a columnist. I write a column in a newspaper in Israel on economic issues, policy issues, and I'm here to talk to you about how to talk to journalists. Journalism is important when you want to push an agenda. You wanna have the media involved, and there are a few let's say tricks or tips I can give you on how to speak with journalists that might help you promote your agenda. So the basic rule in like any important media outlet or the basic thing you study in journalism school is the rule of new, important, and interesting. And the thing is, new is everything that wasn't published, and it could have happened like 100 years ago. But if it's only now revealed and it wasn't published anywhere else, then it's new. The important part is like big issues, global impact, substantial issues. There's obviously something individual about it, but you can say important is something that is important to many people. It's like a war going on somewhere, international relations, bigger like global agreements or something like that. It's considered important. And the third thing is interesting, which is a little more, let's say, gossip or like, tabloids, stories that people would want to click on. Okay. So if you say important is like a war going on somewhere in Eastern Africa, that is, universally important. But if something is happening with Kanye and Kim Kardashian, then it's interesting. Okay. So the rule is that everything has to be in the newspaper world, like the newsfeed world. Everything has to be new, but it should have another thing. So it has to be like new and important or new and interesting. And if you have all three, something that is like new and important and interesting, then it's like a golden item that every journalist would want. If I can give you an example of something that happened here in Israel, is our former Prime Minister Benjamin Netanyahu was accused of a few crimes, and there was a trial. There is still a trial going on. He's not the Prime Minister anymore, but it was a very, very big story because it had all three. It was new. It was important because he was the prime minister, and it was interesting because it had a lot of gossip going on, a lot of stories from vaccines, and it was a really golden item that all the outlets opened with, and it was a big story going on for months, and it still is. So if you can find a way to present yourself or your story as new and important or new and interesting or all three, then you're probably golden, but keep that in mind. Another thing you should know about journalists is, unfortunately, they're usually very lazy or very busy, and usually they're both, and they're always flooded with tons of information all the time, especially in the digital age. There's all this information coming from various outlets all the time. And the biggest, most important job of a journalist today is to sort and pick from these tons of information, that something that is interesting or new or important, and to figure out what is news and what isn't. And they have to produce a lot of content all the time. They need to, there's websites, like every journal, every journal, every newspaper has a website, and it's updated 24/7, and you have to create news all the time. So you have, on the one hand, you get a lot of information, and on the other hand, you have to put out a lot of information, and you have to do all the sorting and figuring out and research in between. And if you can find a way to put yourself in that position where you can be the person who can help them sort through the information, explain it to them in an accessible and easy way, and help them, to cook it into an item. If you can do that, then you're extremely valuable to every journalist, and they would want you to give them stories. Okay, so I will give you a few examples on ways you can be valuable, or you can give an added value to a journalist, and make your stories shown. So if you can be valuable for them, then they will publish your stories, and you can ask them to enter a quote of yourself, or publish other things that you are interested in. But the thing is, you should find a way to give them that added value. So one thing is you can do is, if you are very knowledgeable on one thing, or you read a lot of research on a certain subject, and you're very familiar with it, you can give them like a review of essays, or translate essays or articles, scientific essays, and give it to them. You would give them a big shortcut that they can use, and they can find helpful. Journalists love data. They like, if someone breaks down the numbers and explained it to them, and gives them, the charts that they can show. They like surveys. If you can, it's usually quite cheap. It's not very expensive to do a survey, but it's an item that every journalist would take. They like international data, comparisons from other countries. It gives them perspective. They usually don't have the tools, to read in different languages, or the time to do that, or figure out what is a reliable source of information and what isn't. So if you are a global community, you can share information with one another, then you can be valuable to journalists from different countries, because you can translate things and give them relevant information that is really, really priceless for a journalist. If you can give them a subject for interviews, someone who's an expert, who is reliable, who is eloquent and knowledgeable, and they can use a few quotes, or take someone for TV or radio, then you can give them something that's very useful. And another thing that is especially important for TV is a human face, a human story. Statistics is always good, and data, but if you can attach a human story to it, like the mother crashing at home because the kids are not going to school because of COVID, it tells the story that much better, especially on TV, or a doctor crashing in a COVID ward or something. If you can give them both the data and the human story, then you're golden. Okay, that is a good way to present yourself to a journalist. Important thing you should remember when you're talking to a journalist: always be concise, be very short and to the point, because of all that information flow there. Keep getting if you're a journalist and you're covering a field, you would get hundreds of messages every day from people you don't know, trying to sell you a story. Okay, and you need to figure out what that person wants in like a sentence or two, and figure out if it's interesting to you or not. Okay, because you wouldn't take a a whole story, every story they give you. So what you want to do is present yourself and say, my name is Ricky, I'm this and that, I work here, and I have a story I thought you'd be interested in, and then say that story in one sentence or two top. Okay, think about a Twitter, like just a Twitter platform, and use that. You want to say it as short as possible. You can add maybe a paragraph or two later to elaborate, but always sell it in like a one sentence or two, and then say, I'd be happy to elaborate in a call, okay, or a meeting, and then try to get their interest and make the call to explain it. Be brief on the call also, so don't be too long. But because of that big flow of information journalists are getting all the time, and if you can it can do that, then you'd be valuable for them. Another thing, Meir said it before, but reliability is everything. You have to be reliable. You have to be credible. You have to give them credible information, or they will never talk to you again. If one time you give them like incorrect data, and God forbid they published it, then they will never pick up your phone again. Okay, so it's always better to say, I don't know, or I can look into this and get back to you, than give them information that you're not sure of or is not accurate. So never mislead someone or give them inaccurate information. Always like double check yourself. Or what you can do is give them a tip, okay? And be very exact on what you say. You can say, I heard about this thing. I'm not sure it's true, but I thought it would be interesting. You should take a look into it, okay? If you heard a story going on in some hospital, but you've never been and you're not sure if it's true, you can give them the tip. And if they're interested, they would go and look for themselves. But you gave them the tip, but you didn't put your name on it, okay? Or you didn't made any commitment that is necessarily true. Just give them the tip. That way you can keep your reliability. Another thing is being accessible. Journalists like to having someone that they can, call, get information, ask questions. If you can be that person, it would be helpful for them and helpful for you. You can influence the news going on. You should try to create a personal relationship that is based on professional appreciation. So you could invite, and it's common, well, in Israel, but I know in other places as well. You can invite a journalist if he covers like a field you're interested, say health. Okay, you can invite them for coffee, sit down, talk to them, explain who you are, present something you want to present, come with something you want to show them, and try to make that into a relationship. Try to write to them, send them ideas, send them stories. If you'd be that person, and if you have stories that are interesting, then they would go back to you. But don't hesitate. Like, it's very common to sit with experts and talk to them over coffee. And I would leave a few more things to Shuky to talk about, but I would just say one last thing is timing. Certain subjects have like a specific time. For instance, education has like September 1st, and everyone talks about education when school starts, or if there's a big strike in schools, or results of big tests are published. You want to time your bigger stories to that time, because then they would get more exposure. They're more likely to go into any news publication, and that way you can put in stories that would not necessarily go. That is timing is important. On the other hand, you have like dead news times where there's no news, nothing interesting is going on, and journalists are dying to find any worth any news worth their time. So you can find those times and give them like the stories that are less sexy and not very interesting. But if it's dead news season, they would maybe publish it. That's it on my end. I'm sure Shuky has a lot more to say about media strategy, but it's been nice talking to you. And if you have any questions, I'm here.
Thank you so much, Ricky. That was awesome. Really great tips on how to provide some substantial information to our journalists. Thank you so much. Does anyone in the audience have a question? All right. Well, we will move to Shuky, our final speaker, Shuky Blass, Director at Media at Kohelet, the media planning strategy. Go ahead, Shuky.
Hi.
Hello.
I see that time is short, so I'll try just to touch the main points. I won't even introduce myself besides for my name. Okay, my name is Shuky Blass. I'm the Director of Media at Kohelet. And I'll just cut to the chase. Okay, the first thing before we start dealing with the media, when we're planning the strategy, the first thing is to check whether we even need the media, whether we want to do things through the media. There are times that we can get our names published, we can get the issue published, but it might cause a backlash. It might stir a powerful reaction that would be counterproductive. I'll just give one example, okay, that something that happened in Israel many times. There were stories of people who passed away from COVID. And then the question was, were they vaccinated? Were they not vaccinated? Were they for? Were they against? And sometimes the organizations that brought the story thought that they're proving a point, and at the end they didn't know exactly what happened. They proved the wrong point, or even if their facts were right, people took it in a very negative way, and it was counterproductive. So not every story, even a good story, won't always promote your agenda. Another thing we need to do before we start is to map all the relevant players. And when I say the relevant players, I mean also within the field, like other organizations that are close to us, but also key players within the media. So in our field, we need to see which organizations or key figures can help us. Sometimes it could be politicians that we'll want to use, as Meir spoke before. Sometimes they can deliver our messages better than us, or maybe they can address people that we can't address. And it could be different kinds of allies. In the media, we need to map the different kinds of media outlets. We need to categorize whether it's national or local, whether it's sensational media or deeper media, and even sometimes lazy reporters and diligent reporters. Okay, that can save us time, and it can also help. It can also guide us in how we write our reports, how we write our the ideas we wanna pass on. And then we go through the right means. Okay, because there are different means we can use. We can use op-eds. We can use reporters that we can just try to give the information to. There are interviews. There are different media means that we can use, and we should do that according to the messages we want to pass, according to what we have, according to the information we have. another important thing that I think people miss a lot of times in different fields, and that is about preaching to the choir. There are some organizations that feel it's wrong to preach to the choir. It's not a smart way of using our resources. I tend to think that it's not true. It's very important to preach to the choir. The choir, especially at this era, you have, if you preach to the choir, if you have a lot of people who think like you, who get the right information, the right data, afterwards they'll go and they'll spread they'll spread the truth, they'll spread the facts that you want to be out there, they'll spread them in the social media, or if they're interviewed, they'll spread it there. So that's very important, and you shouldn't feel that it's wasting resources. Of course, it's not the only thing, but it's not something that people should feel is a waste. Well, creating news is something that Ricky spoke about. I won't repeat it. Following what's trending in the news, very important to see what the media is talking about. Even if they're talking about the war in the Ukraine, there are always some aspects that have to do with what you're doing. Find those aspects, try to see how you utilize it, and how you manage to take the facts that the messages that you want to pass on, and use them with that trending news. And the last thing that I find important is the interviewees that you need to prepare. And there I would say there are two things. One is try to make a list of experts and have it not only by topics, but also by subtopics, especially when dealing with matters that require a lot of expertise. So it's not enough. In some places it's enough to just be like an expert in general, someone who knows something about statistics or someone who knows something about health. But especially when interviewing to more to journals that require more expertise, then you need to divide the people you have to subtopics, to expertise that's more specific. So you need to have that list. Besides for that, you need to have a list by the qualifications of those people in interviews and op-eds. There's some people are very good at writing op-eds, but they're very bad at interviews, and vice versa. And those people should be accessible. It doesn't help us if it doesn't help to have a great expert that's never accessible, that's always busy. You need to know that you have people that you can always send to be interviewed. That's it. I think those are the main points I wanted to make. Thanks for listening.
Excellent, Shuky. Thanks for those final pointers and tips. Thank you, everyone at the Kohelet Policy Forum and the Civil Society Forum. This has been so informational. As I said before, the World Health Network has a lot of the right science. We know the tools, and we will be able to use these tips to better promote our message and impact policy. So thank you so much for coming. You can find the World Health Network on Twitter at the WHN. That's at the WHN. And you can learn more about us at worldhealthnetwork.global. Thank you so much, Adi, and to all of the speakers for your time this evening. Have a wonderful day.